All right, just how crucial are HIV prevention strategies in the fight against the virus? So how do we begin to also reach out to, the vulnerable groups as well as to protect them? Let's have a conversation now and speak to Dr. Nelson Igaba, technical specialist for voluntary medical male circumcision at Right to Care, and Richard Lessels, Caprice Research Associate and Group Leader at CRISP UKZN. Let me thank you both for your time this evening. I'll start with you, Doctor. The important role that strategies play in reducing transmission of the virus. Let's start with that.
Good evening, Bogiwe, and good evening to your viewers. It is very important, of course, to emphasize the importance of prevention in the fight against HIV. I think for you to understand this, you just have to understand what we are dealing with in South Africa. The recent report that was just released by the HSRC shows that we have close to 7.8 million people who are living with HIV in our country, with a prevalence rate of around 12.7%. And when you look at the UNAIDS data of 2022, it shows that we get close to 170,000 new infections in South Africa every year, of which 65% or more of those are among women 15 years and older. So the way we always describe the HIV epidemic, it's like you have a bucket of water that has a small tap at the bottom but has a big tap at the top. The big tap is the new infections that are entering into the community, whereas the small tap are the people who are dying. So if we can close the top tap and we do not get new infections into the epidemic, that means we should be able to control with other measures that we have in place, like putting people on treatment, making sure that they are suppressed on their treatment. Then we shall be able to control this HIV and we'll be sure to end HIV by 2030.
Richard, I wonder if you agree with that analogy. I'd like us to stay with it, that if the tap is closed at the top, we will see a much more controlled situation.
Oh, absolutely. And of course, this is it's all connected. I mean, we've seen great progress with treatment, with the expansion of antiretroviral therapy to the people that need it. And that, of course, reduces the number of new infections. It reduces the spread of infection. But we've done less well at really protecting the people who are most at risk of acquiring HIV. And that really needs much more effort now to scale up the tools and the medicines that we have for prevention, as well as all the other technologies, to really protect those who are most at risk of becoming infected with HIV.
And Richard, let me stay with that, and let's talk about, these vulnerable groups and how important then would be targeted strategies, particularly when it comes to them, in order to ensure that they're protected, but also we see prevention in that regard as well.
Yeah, I mean, we have a good understanding of who the people most at risk are. And as Nelson said, we've known for a long time, particularly adolescent girls and young women are the most at risk of infection. But there's also, as you say, many other vulnerable groups, people who are at higher risk of acquiring HIV, and also not just maybe at higher risk of acquiring HIV, but maybe less likely to be accessing services, to be accessing prevention services. And so we really need to bring services closer to those people. And as your previous guests have said, that's really where kind of community-led programs come in. We need to design programs, implement programs with people and with the communities at the heart of it, leading those things so that these are effective and so that they bring the services to the people that most need it.
And Dr. Igaba, I'm going to, get into some of the preventative methods or measures that we can take in just a moment. But this community engagement aspect of it is quite critical, and it has come up somewhat this evening. Are we listening more and more to those communities that, are being engaged in this particular subject, and how sometimes they would want to be communicated with in order to have the message land effectively?
Yeah, no, thank you, Begiwe. I think we need to appreciate the strides that we have taken from the early 2000s to where we are. Yeah, and that shows that there has been some level of listening, but there is still a lot that needs to be done for us to end HIV by 2030, like our target is. Like this year's theme for World AIDS, they let the communities lead. I think that's a very strong theme to ensure that the strategies that we are putting in, either prevention, care, or treatment, they should be differentiated to the different categories of people at risk, so that they are able to be reached in the communities wherever they are, and they access the services without any fear, without any stigma, and without any challenges in terms of access to health care. You mentioned the issue of prevention. Prevention in HIV, it's a multi-pronged approach. It ranges from the behavioral response to biomedical response and barriers like the condom. So we are focusing strongly on the biomedical prevention because we have tools in our box that show that most of those biomedical prevention that I'll list to you are really doing wonders in terms of preventing transmission. For example, we can look at treatment for prevention, where you find pre-exposure prophylaxis, post-exposure prophylaxis, and ART itself. And these are castigated according to the risk of the people who are involved in terms of getting HIV. Look at voluntary medical male circumcision, that is a once-off, lifetime procedure that involves the removal of the foreskin, which is a kind of a magnet to the cells that attract the virus. So this has shown to prevent HIV by more than 60% in males from a heterosexual intercourse from a female who has HIV. So we have the tools in the box. It's just about applying them, getting them closer to the people, and ensuring that we monitor them for effectiveness.
And Richard, right at the back of that, we talk about the treatment and how it's evolved over time, and how, South Africa has made continuous strides in this. But there's something that we saw during COVID, which was, quite effective. And that was the tracing of the patients to make sure that you know where they are, they're taking treatment and everything, and how effective the tools were. In this particular case, are we winning that fight to make sure that everyone continues to take their treatment? They're not defaulting. We know who they are and where they are.
Well, I think that's a great strength of the HIV program in South Africa is the kind of monitoring and trying to support people on the kind of lifetime journey on antiretroviral therapy. Of course, there are always people who unfortunately drop out of care, and I think that there's still a lot of work needed to bring people back into care when they've interrupted their treatment, when they've dropped out of care. And there's lots of effective strategies to do that. There's been lots of work in that area to tell us how best to do that. That's another example of where it's people who need more help from us, more support from us to kind of maintain things. I think coming back to prevention, one thing that we know much less well is how well people are staying on prevention medicines. Yeah. So we know we've got a rough idea how many people have started pre-exposure prophylaxis. So that's taking antiretrovirals to reduce your risk of acquiring HIV. I think what we know much less well is how many people are staying on those medicines and getting the kind of sustained benefit from those medicines. And these are things that we need to kind of improve with how we monitor and see the results of our programs.
And let's talk about the impact of that, Richard. Oh, I see, Doctor, you wanted to say something?
Yes, I just wanted to add what Richard has said. I think Richard is spot on that. we have seen quite some challenges in terms of, retaining people on the pre-exposure prophylaxis. But there's light at the end of the tunnel with the injectable prevention medicine coming into effect. And we are really looking forward to the South African government being able to make this accessible to our communities so that people can get an injection either at first every month, then every 2 months thereafter, and then they will be prevented from getting HIV. And this has shown that is very effective in many of the studies that have been published. And I think we'll really see, we are seeing quite some good response in terms of the people, in terms of people who are eager to get onto this. And this should really be a game changer within our communities, getting as many people who are at risk. We are talking about men having sex with men. We are talking about females with multiple sexual partners. We are talking about young adolescents and young women. Every 2 months, get an injection. You're protected from HIV so that we can prevent any new infections.
And both of you have really left us, with more information. I wish we had more time. I can talk to you the whole day. Thank you so much for this information. And as you say, Richard, something that is critical, both of you mentioned, we need to know how many people are staying on prevention medicine, particularly because even the previous guest was talking about how when someone tests negative, how do we begin to talk to them about staying negative? But let me thank you both for your time, and hopefully we pick up this discussion in the future. It's been great. That was Dr. Nelson Igaba, technical specialist for voluntary medical male circumcision and Right to Care, in fact, and Richard Lessels, Caprisa research associate at group leader at CRISP UKZN. And we talk about preventative measures as tomorrow marks World AIDS Day. These are big conversations that must be had and really had 365 days.